Hi, my name is Stacy Goslin, and I'm going to be talking about the various diagnostic imaging modalities. I know that a lot of people hear radiology or diagnostic imaging, and they automatically look at plain old X-ray. Fortunately, the field has grown so much over the last 20 years that diagnostic imaging has actually branched off into 5 or 6 different modalities. The big modalities that you will see are radiology, which is plain X-ray, computed tomography, also known as CAT scan, ultrasound, interventional radiology, nuclear medicine, radiation therapy, and magnetic resonance imaging, also known as MRI. Radiology was the original diagnostic imaging modality. It's the science of using ionizing radiation in order to penetrate the patient. In 1895, on November 8th, Röntgen actually discovered the unknown ray, which is why it's called X-ray, kind of like the X in algebra, because it's unknown. The radiology field was based on this ray hitting a photofluorescent film across the room, and we then discovered the fact that it penetrated the body, and we were able to see through the body and look at bones and such. Radiology became its own science, but at first it was used for monotonous things. Radiology and X-ray more commonly was used to see if kids' shoes fit. They used to use it to look into opaque objects, not realizing the danger of the X-ray radiation. The following slide shows what a common radiology room looks like. On the left, you have a tube, you have a console. The console is surrounded in lead, along with the room being surrounded in lead. Radiation is something that is very well monitored by the state and by the governing bodies. So all rooms are surrounded in lead. The radiology personnel wear radiation monitors and other radiation monitoring devices that we'll learn along the way as we go into the different modalities. The images on the right are something more common that everybody can pretty much identify as X-ray. I'm sure many of you in this class have had a simple chest X-ray or a simple back X-ray. As you all know, they don't hurt. They penetrate the body and they're attenuated. Attenuating meaning the original power of the X-ray coming out of the tube is slowly diminished as it goes through the air, enters the patient, and exits out the back of the patient onto the film. The second modality is computed tomography, also known as CAT scan. It is a radiation using modality. It is X-rays in conjunction with computing algorithms to image the body. In CT, an X-ray tube opposite the detectors are in a ring shape, and the apparatus rotates around the patient, producing a computer-generated cross-sectional image. The way I explain this to my students are if you were a loaf of bread, a CAT scan machine scans the whole loaf of bread, and then you're able to pull one slice of bread out at a time and see what part of the body is actually, what parts of the body are actually in that slice. Computed tomography has a much greater amount of radiation associated with it. Patients who have CAT scans or CT scans receive a much higher amount of radiation. computer tomography gives much better pictures. It lets us look at the vessels of the body. It lets us look at the heart. It lets us look at the brain. It lets us see if the patient has had a stroke. Is it new blood? Is it old blood? All by the different shades of gray or black of the image. Computer tomography, there are different levels. There are scanners that go much slower. As you can see, there are, as I explained earlier, there are X-ray detectors. The more detectors, the faster the machine scans. So right now we have scanners that go from a 4 to a 320. A 320 scanner can actually scan in between beats of a heart, in between heartbeats. They're used for cardiac scanning. Cardiac scanning has one of the highest radiation doses to patients. But as we explain to our patients who are worried about radiation dose, it's a risk versus a benefit. Would you rather know what's wrong and be able to treat yourself, or not know what's wrong? I've also given some images of what a plain CT scanner looks like. The circle part of the CT scanner is called the gantry. The bed or the couch is where the patient lays and then goes into the scanner. On the right, you'll see images of the brain. Those are what we call sagittal slices through the brain. We can actually image in any plane of the body. We image sagittal, which divides the body into right and left. We can image in coronal, which divides the body into front and back. Or we can image the body in axial, which divides the body into superior and inferior parts. The CT scanners can also allow us to image in obliques, which allows us to scan the body in any plane that we really want. But coronal, sagittal, and axial are the three major and more common of the three planes that we image in. Ultrasound does not use ionizing radiation in order to obtain images. It's actually high frequency wavelengths. Ultrasound is a very interesting field, not only as an ultrasound tech, being able to look at the body and tell the doctors what they see, but it has various parts to it. Ultrasound techs not only image babies, which is usually the first thing people think of, but they also image vessels of the heart, vessels of the arms and legs. They look for deviated, for DVTs, and they look for thrombosis, and they look at the thyroid and see if there are goiters. The ultrasound techs have to be very well skilled and very well studied in order to get into this field. Unlike the other modalities who have radiologists who can say, go back and get that image, or, I need more pictures of this. The ultrasound techs are pretty much responsible for what they see, and their notes are heavily dependent upon by the radiologist. All ultrasound techs have to take individual boards for each separate part of the body. This is the only modality in which this is possible. The ultrasound techs all have to pass their individual physics board, and then they have to take boards in abdomen. They have to take boards in gynecology or obstetrics, and then they have to take a third board in vascular, depending on what they're wanting to do. When you look at the other modalities, you just take one board for everything. So the ultrasound techs have to be very well studied and very much involved with the scan and with their studies in order to get to this point. I kept it easy with these pictures. The picture to the right is obviously a fetus or a baby. Usually the more common of the pictures that we think of when we look at ultrasound. And then, again, on the left is a ultrasound transducer. That is how they obtain the images. The sound waves actually come out through the transducer in the technologist's hand. And, when it hits the various, organs or parts of the body, it is then transduced and received by the same transducer and then gives us our image on the screen. Interventional radiology, or IR or VIR, is a subspecialty of radiology. It is minimally invasive procedures are performed using image guidance. Some of these procedures are done for purely diagnostic purposes, while others are done for treatment. Some interventional radiology procedures for diagnostic purposes could be an angiogram. An angiogram is when a patient is injected with contrast, and we actually can image where the contrast goes. Many people have deep vein thrombosis or DVT or a clot in their leg. We're able to inject the iodinated contrast into the extremity, and we're able to see where the clot is. So a diagnostic purpose, for instance, a clotted vessel, can then turn into a treatment purpose, an angioplasty, where they actually blast away the clot. Different ways. They can heparinize it, they can remove it. It really depends on the type of clot it is. Where we don't just use VIR or IR for clots. We also use them for aneurysms. We can use them for vascular disease, renal artery stenosis, vena cava filters. Interventional radiology has definitely changed the way that we do surgery. Instead of going in and opening up a patient from sternum to pubic symphysis, we're able to take x-ray and this minimally invasive procedures and get the same kind of placement and diagnosis with much faster heal time for patients and a much lower infection rate. Interventional radiology maps and allows the clinician to guide these instruments through the body to the areas in which the contains the disease, and we're using radiation, and we don't have to cut the patient open. The images on the left are a team of interventional radiology. There's always a physician in the room. There's an interventional radiology technologist and usually a nurse. The image on the right are various images of interventional radiology. The first picture being those are the kidneys and the renal arteries. And then images 2 and 3 are the aorta and the various vessels that come off of the aorta. Nuclear medicine. Nuclear medicine is imaging involves the administration into the patient of a radiopharmaceutical consisting of substances with the affinity to a certain body tissue labeled with radioactive tracer. The more common of the tracers that we use in nuclear medicine is called technetium. We do use iodines and galliums and indiums. Iodines are usually for thyroid imaging. Galliums are usually for infection imaging. Thallium is usually for cardiac imaging. And fluorodeoxyglucose is for cancer imaging. Nuclear medicine is a little different than radiology due to the fact that the patient is the source of radiation and not the machines or the camera or the gantry like in CT and radiology. The patient is injected with a radioactive substance that radiates off of them until it is what they call dead. All of the radioactive substances that we inject with have what they call a half-life. A half-life is the amount of time it takes for the original dose to be halved. For example, technetium has a 6-hour half-life. So if a patient is injected at 8 o'clock with 20 millicuries being the unit of measurement, 6 hours later, it would be 10 millicuries. Each